Hi. In the last episode, we discussed about ERP, exposure and response prevention, and we saw that when a person has only obsession and no compulsion, ERP has limited value. Let us see what do we do in such a situation. Welcome to Mindscape Matters, and I am your host, Dr. Mohan Raj, a consultant psychiatrist. I have to give you a disclaimer here. These videos are made for educational purposes only, to improve awareness. This is not a substitute for treatment. For your treatment, please contact your local psychiatrist or therapist and take help from them. If a person has only obsessions and no compulsions, we use a cognitive behavioral therapy technique called audio exposure. So we will look at what audio exposure is today. In an earlier video, we had talked about how exposure in general helps in anxiety. When we expose somebody to an anxiety-provoking stimuli, over a period, in a graded fashion, the person gets used to that stimuli and the person's anxiety keeps coming down. Similarly, the same principle is used in audio exposure. We tell the person to write down their obsession. Normally, they are very hesitant to write down the content of their obsession, especially if the content is blasphemous, sexual, or very inappropriate. But with a lot of reassurance, the technique goes like this. We tell them to write down their obsessions and make a script based on it and exaggerate so that it's anxiety provoking. So it will be something like if they have an obsessive urge to shout at an inappropriate time in a very solemn place, we tell them to write as if they shouted, because their fear is, will I yield and will I shout? What will happen? And they become intensely anxious. Whereas we tell them to write a script where they are actually in a solemn place, like in the first person. They have to write, I am there and this is going on and I have this urge and I just yield and I scream and everybody shouts at me, everybody beats me up. So it can be made anxiety provoking. Similarly, with blasphemous, we can tell them to write whatever the obsessive thoughts are and write in such a way they yielded and how people around them behaved violently. This is their ultimate fear, that I might be beaten up, I might be ridiculed. So write all that in, and then we tell them to record it in their own voice. And if it comes to say 5 minutes, 6 minutes, 7 minutes, we tell them to loop it. That means the same recording of 5 minutes will be looped every 5 minutes. And last part is we tell them to listen to it at least for half an hour to 1 hour a day. Now, when they listen, they become extremely anxious. They are exposed to this anxiety-provoking scenario. Initially, they become anxious. It's better that the initial listening is done in the presence of a psychiatrist or a therapist. And we tell them to keep relaxing all the time. And gradually, when they are exposed to the same audio stimulus again and again, somewhere along the way, their anxiety to that anxiety-provoking stimuli comes down. And we have seen, along with anxiety coming down, the obsessive symptoms also come down. The effectiveness of audio exposure has been well documented in many research papers. But the barrier is, when we tell about audio exposure, the person sometimes are hesitant because they don't want to write down their obsessions and they don't want to keep listening to it again and again because they think it will somehow aggravate. Now, more than the person who's suffering from OCD, family members, when they hear about audio exposure, they freak out and say, please don't do, because they think he's already having a lot of these thoughts and you are telling him to write it down, record, listen again and again. It's going to aggravate his situation. And many times it's the family members who persuade the person not to go ahead with audio exposure. Audio exposure is not offered as the first line of treatment. It is offered only when the first or second line of treatments are not effective. Then it comes to the play. In a motivated person with a well-trained therapist or psychiatrist, audio exposure is a good tool in fighting OCD. The next episode, let's look at the medicines that are available for OCD. Thank you for watching this far. If you like this video, please tell some of your friends. Stay tuned because Mindscape matters. Bye.